Vipin, good morning. Good morning, Vipin. Mhm. Just waiting for some time so that others could join ASAP. Yeah, so that others could join ASAP. Yeah, yes, just waiting. Ashish, good morning. Good morning, Ashish. Yeah, so just waiting for others to join us up, and then we'll start with the pathology image discussion today. And I will try to cover the high yield pathology like images which are relevant for the upcoming FMG June exam. So yeah, another 2 minutes. Let others join us up. So like yeah. Chetan, good morning. Good morning, Chetan. Yeah, I'll just open the presentation as well. So yeah, just waiting for others to join. Yeah, start now, guys. Yes. Vikas, good morning. Good morning. Good morning, Vikas. Okay. Let's start with the class, guys. Yeah, I will be discussing images related to pathology in this particular discussion. Some images like I have handpicked, like which I felt are relevant for the upcoming FMG June exam 2022. So yeah, guys, let's start. Let's start, and I want active participation. Whosoever is participating. So the very first image that you can just see on your screen, it is of yeah, I'm just waiting for your answers. Like anyone would like to comment in the chat box, or yeah, I'll just go with the answer, guys. As like yeah, it is the Barrett's esophagus, guys. It is the Barrett's esophagus. It is the Barrett's esophagus, guys. And remember, what happens in Barrett's esophagus? Basically, we have a like yes, it is the metaplasia which is taking place. You know that we have the squamous cells over here. You can very well appreciate in this particular image that we are having the squamous cells. So what is happening, the squamous cells the squamous cells are actually changing into the squamous cells are actually changing into columnar cells. They are undergoing change. Okay, one like mature form is changing into some other mature form. That's the changing of the squamous cells. You can just move down and see that we have the columnar cells over here, guys. You can see very well appreciate that we have the columnar cells. Okay, so squamous cells is undergoing a change, and you can appreciate in the picture over there that this is the columnar cells, guys. This is the columnar cells. Okay, so this type of metaplasia in which squamous cells are undergoing change to form the columnar cells, it is called as columnar metaplasia. It is called as columnar metaplasia, or it is also known as the intestinal metaplasia. It is also known as the intestinal metaplasia, guys. So remember that columnar or intestinal metaplasia, it is basically the hallmark of Barrett's esophagus. It is the hallmark of Barrett's esophagus, guys. It's the hallmark of Barrett's esophagus. And just remember one fact, that this metaplasia is in turn increasing the risk of esophageal carcinoma. It is increasing the risk of esophageal carcinoma, guys. It is increasing the risk of esophageal carcinoma. So yes, so welcome to the class, but this will more focused on the students who are going to appear in the upcoming FMGE exam. So yes, yeah. So that is about the Barrett's esophagus. That was the first image that we discussed today, guys. That was about the Barrett's esophagus, in which we can see the metaplasia, from change from squamous cells to the columnar cells. Columnar metaplasia, intestinal metaplasia. Intestinal or columnar metaplasia, basically it is the hallmark of Barrett's esophagus, and in turn it is increasing the risk of esophageal carcinoma, guys. Okay, now what else we can see? See these columnar cells are basically having like vacuoles. Now suppose this is the columnar cells. Okay, these are the columnar cells. Just according to the shape, you can find some vacuoles basically just at the base of these cells, and these vacuoles are basically called as the mucin vacuoles because they are filled with mucin. So these are the mucin vacuoles, and in turn basically this particular structure in which the vacuole is filled with the mucin, it is called as the goblet cells. It is called as the goblet cells, guys. So yes, that is also like more prominent in case of columnar metaplasia or intestinal metaplasia. Basically goblet cells are like more prominent in these cases. Goblet cells are more prominent in these cases, guys. Yeah. So moving on to the other image, guys, you can very well appreciate that this particular image, it is the Alchian blue stain. It is the Alchian blue stain, and in this particular stain basically you should remember that it is the Alchian blue stain which is used over here. And remember, guys, that the mucin basically it is like having 2 pH. Suppose the pH of the mucin is around 2.5, then it's actually the Barrett's esophagus. And if suppose the pH is 7.5, it is, see, 2.5 it is the acidic pH, and 7.5 it is the alkaline pH, guys. So it is more like at pH 7.5 you will be more able to appreciate the intestinal goblet cells. You will be more able to appreciate the intestinal goblet cells at this particular pH. So this is just you can see, yeah, the Alchian blue stain in which you are able to identify all the columnar cells over here. Okay, so yes. Coming on to the next image, that is the electron microscopy. Yeah, this is the electron microscopy, guys, which you can very well appreciate in the given picture. Electron microscopy, and what you can see, it is the myelin figure, guys. It is the myelin figures. It is the myelin figures. Now what happens? See, there is an increase in the cytosolic calcium, which will actually activate the phospholipase, and remember that calcium, when combined with phospholipase, basically it will form these concentric rings. जैसे वो onion के rings होते हैं, it's just similar to that. You can just write it like as concentric. Basically these are laminated, okay, structures. These are laminated structures, and moreover we have the wall like structure, guys. We have the wall like structures. And yeah, see, these myelin figures are seen in both reversible as well as irreversible injury. These are seen in both reversible injury as well as irreversible injury. These are seen in both reversible as well as irreversible injury. But if it is like out of the both options, like more correct would be the irreversible injury, guys. Irreversible injury is like the more perfect answer in these cases. Okay, so yeah, this question I think multiple times it has been asked. So yeah, it is the fourth image that we are discussing, guys. It is the agarose gel electrophoresis. Gel electrophoresis. You can very well appreciate that this is the step ladder pattern. This is the step ladder pattern. This is the step ladder pattern. And this step ladder pattern, basically it is this step ladder pattern. Basically it is seen in apoptosis, and okay, it is seen in apoptosis. Yeah, okay, it is seen in apoptosis. And the smearing pattern, बिल्कुल एक smear की तरह बना हुआ, the smearing pattern, you can just see it's like a smear. Okay, it is seen in necrosis. Yeah. Now guys, coming on to this particular image, you can see chalk like calcium deposits. Okay, chalky white calcium deposits. These are more prominent, guys. You can see over here. So these are chalky. This is the fifth image, guys. This is the fifth image. Yes. So you can very well appreciate that these are the chalky white calcium deposits. Chalky white calcium deposits. And it is basically the fat necrosis, guys. It is the fat necrosis in which you can appreciate the chalky white calcium deposits. And yeah, examples are like they are more asking examples nowadays, and you should know that it can be the traumatic, it can be traumatic fat necrosis of breast, traumatic fat necrosis of the breast, guys. Along with that, you can, like the other example, if you want to mention, it can be fat necrosis due to acute pancreatitis. Due to acute pancreatitis. Yeah, so these are both the examples that are like, yeah, relevant over here. Yeah, it is the traumatic fat necrosis of breast or fat necrosis due to acute pancreatitis. You will be appreciating the chalky white calcium deposits. Yes. Apart from that, guys, now coming on to, yeah. You can very well appreciate that this particular structure, it is basically of a, yes, it is of a neutrophil. It is actually of a neutrophil, guys. It is of a neutrophil. Mudit, I hope so, if I'll share it. Yeah. Yeah, I hope so. If I'll share it, I'll just let you know, guys. You can see that this particular structure, basically there are multi-lobed nucleus. We have the multi-lobed nuclei, guys. Basically it is consisting of 3 to 5 segments. Okay, and yeah, it is the polymorphonuclear neutrophils. neutrophils, yes, and see, these contain specific granules. Basically, that's why the cytoplasm is little pale as compared to the nucleus, which you can very well visualize. The nucleus is darkly stained as compared to the cytoplasm. So it contains specific granules that give cytoplasm like pale pink color. Okay, the pale pinkish color is basically given by that. Coming on to this particular question, I think this has been asked recently, guys. This particular structure, basically it is the, suppose now guys, what is this organ? Firstly, you should remember, it's not the lungs. It's the spleen, guys, it's the spleen. And remember that it is the miliary tuberculosis of the spleen. It is miliary tuberculosis of the spleen. Now basically the cut surfaces, you can very well visualize, guys, the cut surfaces of these particular splenic areas. You can find that they show numerous gray like tubercles. Okay, so the cut surfaces basically they show numerous gray like tubercles, numerous gray like tubercles, numerous gray like tubercles. Yes. So yes, just apart from that, guys, moving ahead with another image, guys, you can see that we have like yeah, that's I think the very easiest image as of now. You can see the owl-eye appearance type of a structure, that is the cytomegalovirus. Cytomegalovirus, guys, you can see it's the cytomegalovirus, guys. Yeah. Moving on to the next image, guys, you can see that this structure, basically it is the lipofuscin stain, and you can very well appreciate that this particular structure, the brown structure, it is the perinuclear brown pigment. Okay, so this is the stain which is actually helping to stain the perinuclear brown pigments. You can very well appreciate in this particular structure, perinuclear, yeah, brown pigments are there. Yes, just outside the nucleus you're just able to like visualize these brownish dots. These are the perinuclear brown pigments, that's the lipofuscin. Okay, apart from that, guys, you know the clear vacuoles, basically these are just an indication. You already know that this is the fatty changes, okay, which you can very well appreciate in this particular image. These are the fatty changes, guys, that you can very well appreciate as of now. Yeah. Coming on to this particular staining, guys, you already know it is the oil red O stain, and this is basically used for lipids. This is basically used for lipids. You can see the red color staining over here. These are the lipid pigments which are stained in red color. So you can very well appreciate in the image as well. So basically this is the oil red O stain. Red is just the lipids, which you can very well visualize over here right now. Moving on to the next, guys, this is the Pearl's Prussian blue stain. Pearl's Prussian blue stain, guys, and it is basically used for staining the iron granules. And these granules you can very well visualize, these are in blue color, guys, these are in blue color. So this is the Pearl's Prussian blue stain, that is for the iron granules, which you can very well visualize in this particular picture. And basically these are the blue dots which are displayed. These are the blue dots which are displayed. Yes, these are the blue dots which are displayed. Coming on to the next, guys, that this is the von Casa Stain. Von Casa Stain, and you all know that this particular stain, it is actually responsible for staining calcium. It is responsible for staining calcium. You can just remember for from K that this particular structure is kala, right? So yeah, that is black. That is black. So that is the calcium which is basically stained over here. You can see, yeah, this is all the calcium. Yeah, yeah. Coming on to the next, guys, that you should know that this is, yeah. Coming on to the next, guys, that this is the stellate abscess, guys. You can very well appreciate that this is the stellate abscess, and this particular abscess, it is more prominent, like it is seen in cat scratch disease, guys. It is seen in cat scratch disease. Yeah, this is seen in cat scratch disease. So you can see this is a stellate like structure. You can very well appreciate. So this is a stellate abscess. Okay, it is seen in cat scratch disease. Yes. So I hope like everyone, only 6 students are there as of now. So yeah, so it's okay. Chalo. Moving on to the next. Just some pictures from the hematology I wanted to discuss, because hematology is a volatile part from where maximum questions like come from, it's the only part in pathology like from where maximum questions can be put on in the FMGE exam. So yeah, this particular, like starting from the very basic, guys, you should remember that this is the new methylene blue stain. It is the new methylene blue stain, and this particular staining is basically used for reticulocytes. It is used for reticulocytes, and which is basically like you can very well appreciate the reticulocytes over here, guys. Yes, this is the reticulocytes you can very well appreciate. Coming on to the next, guys, this is actually now you can very well appreciate that this is a normal RBC. नॉर्मल आरबीसी में बच्चे, नॉर्मल आरबीसी में यू कैन वेरी वेल अप्रिशिएट कि देयर इज ऑलवेज अ सेंट्रल पैलर. जो बीच वाला एरिया होता है ना वो हमेशा हल्का नजर आता है. Whenever we compare it with another RBC, you can see over here there are two RBCs, RBC number 1, RBC number 2. In RBC 1, you can see a central pallor, that's why it's a normal RBC. And in and in the second one there is no central pallor, no central pallor. And one more difference that I wanted to tell you, ध्यान से देखो कि normal RBC का जो shape है, it is much more bigger than the this second one. So it is the second one, basically it is having a smaller, or the size is smaller than the normal RBC. It is smaller than normal RBC, guys. And remember that this particular structure that I have shown in second, it is the spirocytes. Or this particular image, it is showing spirocytosis. It is showing spirocytosis. Yeah, it is showing spirocytosis. Yes, I think it's very like you can very well appreciate. Now guys, coming on to another image, you can see a normal RBC over here. You can see or appreciate a normal RBC that is shown in this particular picture. We are having a central pale area. Okay, coming on to other RBCs, guys, you can see that the other RBCs, okay, which are not having any central pale area, okay, it is again the spirocytes. Okay, these are again the spirocytes. This particular structure, that is the spirocyte. Okay, now guys, what I wanted to mention, I want to mention a very like particular point over here, that this blue dot which you can see in this particular spirocyte with no central area, this is actually the Howell Jolly bodies. It is the Howell Jolly bodies, guys. It is the Howell Jolly bodies. And remember that ये जो blue dot आपको देखने को मिल रहा है, that is basically the nucleus remnant. That is basically the nucleus remnant. You guys already know that कि adult RBC में तो nucleus होता ही नहीं है. So that particular, it is only just a remnant of the nucleus which are you are finding in spirocytes, and that is given a special name that is called as the Howell Jolly bodies. That is called as the Howell Jolly bodies. Yes, guys, and that's why this particular structure, it is also of a spirocytes, and these spirocytes are like in turn special. They are containing the Howell Jolly bodies, basically a nuclear remnant that is denoted by a blue dot over here, and yeah, it is the Howell Jolly bodies, guys. It is the Howell Jolly body, guys. Coming on to the next, guys. Now you can see that कि सर ये वाला हिस्सा ना खाया हुआ लग रहा है. So yeah, that is the bite cell, guys. You can see a bite cell. Okay, you can see a bite cell over here, and these bite cells, okay, you can see the normal RBCs over here, the normal RBCs, and just like in normal RBCs, you can see some other structures which are like bitten. Okay, they are bitten, and this is the bite cells, guys. It is more prominent in cases of G6PD deficiency anemia. G6PD deficiency anemia. It is more prominent, like it's seen in bite cells are more seen in G6PD deficiency anemia. Coming on to some other structures which you can very well visualize, guys. These are Alchian. This is another staining, guys, that is called as the crystal violet stain. Crystal violet stain. And what you can visualize over here, in the crystal violet stain, guys, these are the Heinz body. Okay, these are the Heinz body, which is also like seen in the G6PD deficiency. Okay, so these are the Heinz body which you can just visualize in the crystal violet stain. Okay, stain. Coming on to the next, guys, that this particular structure, you can very well see that it is like clusters. You can very well visualize over here. We have the clusters of RBCs over here. So it is the autoimmune hemolytic anemia. Autoimmune hemolytic anemia. Okay, and that is like just the autoimmune hemolytic anemia. Coming on to the next, guys, you can see the shape of the RBCs, guys, over here. The shape of the RBCs, it is basically larger in size. The shape of RBCs, it is basically larger. So that's why these particular structure, it is basically the macrocytes. These are the macrocytes, and in these structures, along with the central pallor, you can visualize a dot. That dot I have just marked with a blue arrow. You can see these particular dots are basically the Howell Jolly bodies. Howell Jolly bodies, I already told you, these are the remnants of the nucleus, and the structure in which you will find the macrocytes along with Howell Jolly bodies. It is the structure, microscopic image of megaloblastic anemia. It is the microscopic image of megaloblastic anemia. Yes, travel captions, like whosoever you are. See, bacha, देखो, to be very honest, hematology say 2 images are confirmed. Hematology, जो point which I am discussing right now on the screen, guys, like you can very well appreciate कि इसमें से 2 images तो पक्का ही आती है. और आजकल they have started asking systemic pathology से भी, मतलब like in collaboration with like surgery or medicine, उसमें से भी images आजकल आ रही हैं. So what my point is, like at least 3 images should be there. At least 3 images, 3 to 4 images should be there, and just give time on understanding the concept. रट्टा मत लगाना, क्योंकि you won't be able to differentiate the images like in exam. सो क्या क्या बेसिक चीज़ अब मैं सपोज तो मैं बता रहा हूँ कि हाँ, नॉर्मल आरबीसी में क्या होगा, सेंट्रल पैलर एरिया देखने को मिलेगा, मतलब बीच में खाली जगह देखने को मिलेगी, पेल एरिया देखने को मिलेगा, न्यूक्लियस रेमिनेंट मिलेगा. तो यू हैव टू अंडरस्टैंड लाइक दिस. तो वो बाकी सारी इमेजेस में भी तुम्हें लाइक इट विल हेल्प अ लॉट. Okay, so like expect 4 questions, 3 to 4 questions, like expect from this particular image. Yes. So yeah. So in megaloblastic anemia, you will be able to appreciate the macrocytes, guys. You will be able to appreciate the macrocytes. You can see the size of the RBC. The size of the RBC is basically enlarged. So this is the uh, macrocytes which are actually like displayed on this particular screen. Along with these macrocytes, you can very well appreciate that these microcytes are basically the RBCs which are containing, these are normal RBCs which are containing the central pallor area. Basically the size of the RBC has increased. Along with that, you will find that we have the nucleus remnants over here. The nucleus remnants are there, that is the, okay, the nucleus remnants, that is the Howell jolly bodies, which you can very well appreciate in this particular picture. Yes. So that is the megaloblastic anemia, guys. Now coming on to another form of megaloblastic anemia, where you can just see the, yeah, this is the structure of a neutrophil. I just mentioned a few minutes back about the structure of the neutrophil. Basically we have 3 to 5 segments. Okay, a normal neutrophil में अगर एक नॉर्मल न्यूट्रोफिल देखोगे बच्चे, तो नॉर्मल न्यूट्रोफिल में यू विल वेरी वेल अप्रिशिएट कि उसमें तो सर 3 to 5 सेगमेंट्स ही देखने को मिलते हैं. Okay, multilobulated structure होता है, but over here you will be able to appreciate that there are multiple segments. Okay, so this is actually hyper segmented, guys. This is actually hyper segmented neutrophil. Okay, hyper segmented neutrophil. Okay, and along with that, guys, you will be able to appreciate the target cells over here. Okay, you will be able to appreciate the target cells. Okay, so target cells का अगर बेसिक स्ट्रक्चर अगर तुम लोग मुझसे पूछो कि सर टारगेट सेल्स को कैसे हम लोग वी कैन लाइक अप्रिशिएट, सो जस्ट रिमेंबर कि एक तो हमारा आरबीसी होता है, बीच में सेंट्रल और पेल एरिया होगा, और उसके अंदर भी यू विल बी एबल टू अप्रिशिएट अ डार्क स्टेन. सो या वी हैव द नॉर्मल लाइक दिस पर्टिकुलर स्ट्रक्चर होगा. एक तो बाहर से डार्क होगा, फिर अंदर पेल एरिया होगा, और फिर अंदर डार्क होगा. सो दैट्स द स्ट्रक्चर ऑफ अ टारगेट सेल विच विल ऑलवेज अप्रिशिएट इन मेगालोब्लास्टिक एनीमिया. मेगालोब्लास्टिक एनीमिया, megaloblastic anemia. Okay, so yes. So over here also you can just see that we have the hyper segmented neutrophil. Okay, we have the hyper segmented neutrophil. Okay, have the hyper segmented neutrophil. Okay, apart from that, guys, you can see the macrovelocites which I have marked in blue color. These are the macrovelocites, and in green you can very well appreciate it is the Howell jolly bodies. Yeah, in green it is the Howell jolly bodies. Okay, so that is in turn a combination that you guys will see in megaloblastic anemia, guys. Megaloblastic anemia. So I'm just trying to illustrate the disease only with the help of the findings which you will get in the like image, not the clinical features, not diagnostic. I'm just focusing on the image right now. You can see the hypersegmented neutrophils. Okay, the macrovelocites. Okay, its size is bigger, it's more like oval in shape, अंडे आकार की जैसा. So that is the megaloblastic anemia. You can very well appreciate over here also, like we have the jolly bodies. Macrovelocites you can just see over here also in this particular image also. Apart from that, guys, one very important like ring that you will be able to appreciate over here, that is the cabaret ring, and it is characteristically a feature of megaloblastic anemia. So whenever like this particular image comes and you are just able to see a particular ring like structure, you can see a ring like structure, so that is the megaloblastic anemia. And this ring like structure, it is the cabaret ring, guys. It is the cabot ring. It is the cabot ring. So yes, you can very well appreciate over here. This is the cabot ring, guys. This is the cabot ring. Yeah, just try to make it more. Coming to, yeah, the yeah, even in this picture, like you can see, the I just wanted to mention the coarse, or no, it's the fine basophilic stippling. Okay, it is the fine basophilic stippling, guys. Fine basophilic stippling, guys, which you can very well appreciate uh, in megaloblastic anemia. It is the fine basophilic stippling. Okay, can anyone tell me कि coarse वाला किस में दिखता है, sir? So the coarse basophilic stippling, I don't have the image, I think I forgot to like add on. Coarse basophilic stippling, it is basically seen in lead poisoning. It is seen in lead poisoning, guys. It is seen in lead poisoning. So that's again a question important for upcoming FMGE June exam. Yeah. Now guys, what I wanted to tell you, you can very well appreciate कि yeah, this particular structure that I have marked with red. अभी मैंने target cell का structure बताया था आप लोगों को कि सर बाहर से dark होगा, अंदर pale होगा और फिर अंदर dark होगा. So that is the structure of a target cell. You can see a target cell over here, very well appreciated. कि सर बाहर से dark होगा, अंदर पेल एरिया होगा और फिर डार्क होगा. सो दैट इज द स्ट्रक्चर ऑफ अ टारगेट सेल, गाइस. दैट इज द स्ट्रक्चर ऑफ अ टारगेट सेल. Even you can see the blue dots, basically these indicates the nucleated RBCs. These indicates the nucleated RBCs. You all know that RBCs are not nucleated, adult RBCs are not nucleated, but here in this picture you can very well appreciate we have the nucleated RBCs. Okay, apart from that, guys, apart from that, guys, you will be able to appreciate the schistocytes in the green color. Okay, you will be able to appreciate, like I don't have the green color, yeah, it is the schistocyte shape you can see over here. Yeah, that's the schistocytes. Okay, apart from that, you can very well appreciate, guys, the Howell jolly bodies. The Howell jolly bodies you are basically appreciating in every image, so that's not a characteristic feature as well. So you have the Howell jolly bodies. Okay, and remember, guys, you will be able to appreciate in red, basically the hypochromic RBCs. The hypochromic RBCs. Hypochromic basically just pale from the normal RBCs. You can very well appreciate over here. देखो पूरा का पूरा area pale दिख रहा है. Okay, so that is the पूरा का पूरा central area, मतलब majority of the area is pale. So it is the hypochromic RBCs. So these all findings, the nucleated RBCs plus the target cells plus the hypochromic RBCs plus the schistocytes plus Howell jolly bodies, these all clubbed features that I have just displayed on the screen, guys, these are all seen in thalassemia major, guys. This is all seen in thalassemia major. This is all seen in thalassemia major, guys. So these are just the pathological findings which you will like help you to differentiate, guys. So the hypochromic RBCs, Howell jolly bodies, nucleated RBCs, schistocytes, target cells, all these are like in thalassemia major. Okay, apart from that, guys, in the blue also, like it's not more clear, but I'll just try to highlight that ये जो last वाला जो blue वाला structure है, you will be able to appreciate the basophilic stippling as well. So yeah, it will be the basophilic stippling that will add on to these particular features which I have already displayed. It is the basophilic stippling that I have already displayed, guys. That I have already displayed. Yeah. Coming on to the next, how to differentiate it from thalassemia minor. So thalassemia minor, what you will be able to see, guys, firstly you can see a very well appreciated nucleated RBC in the blue. That is the nucleated RBC, guys, which you can very well appreciate in the blue color. Yeah, apart from that, guys, you can very well appreciate a apart from that, guys, you can very well appreciate in green the basophilic stippling. In green, the basophilic stippling, and yes, it is the, I don't have the green color. Yeah, it's the basophilic stippling. It's the basophilic stippling. You can very well appreciate in this particular images. Basically, the granules are scattered all over the, see. Apart from that, guys, you will be able to see a very special structure that is in pink that I have tried to highlight. That is the pencil cell, guys. Pencil cell. Okay, it is more of a structure of a, like a pencil. What's it called as? The pencil cell, guys. Pencil cell. Okay, so basophilic stippling plus nucleated RBCs plus pencil cells, these all will count to the features of thalassemia minor. It will all count to the features of thalassemia minor, guys. It will all count to the features of thalassemia minor. Coming on to the next structure, guys, that this particular structure was given in one of the tests, and they were asking which kind of test it is. It is the Nestrov test. Nestrov test. What does Nestrov stands for, guys? It is the naked eye single tube RBC osmotic fragility test. Osmotic fragility test. And you all know that this particular test, guys, it is basically used for thalassemia screening. It is used for thalassemia screening, guys. And yeah, now how to like differentiate कि देखो, if suppose the lines are present, you can very well appreciate like, let me use some other pen. Yeah, you can very well appreciate that the lines are just present in this second image. So if the lines you can visualize, that means it is a normal structure. It's a normal structure. If there are no lines, guys, if there are no lines, you can very well appreciate it is like the structure of a thalassemia, like it's the RBC of a thalassemia. So ये Nestrov test तो बच्चा पूछा गया है बार बार. That is, first you should know the full form कि it is the naked eye single tube RBC osmotic fragility test. और ये हम thalassemia की screening के लिए use करते हैं. That is just for the screening purpose, not for the diagnostic, guys. It's for only the screening purpose we are using this particular test. Apart from that, guys, how to differentiate between the normal person and the person who is suffering from thalassemia, you can like very well visualize over here कि जहाँ पर lines present हैं, जहाँ पर lines दिख रही हैं तुम्हें, that will again count to the thalassemia. I mean, that will be the normal person. और जहाँ पर lines नहीं दिख रही हैं, that is the thalassemia. If you can't visualize the lines, that is the thalassemia. Now, guys, coming on to a very important image that is basically displayed over here, that is the sickle cell anemia. Sickle cell anemia. You can very well appreciate this particular structure that is in the shape of a sickle. ये sickle shape का है, so that is the sickle cell that you can very well appreciate, guys. That is the sickle cell. And yeah, अपार्ट फ्रॉम दैट गाइस, ग्रीन में तो तुम्हें पता ही चल गया है कि टारगेट सेल देखने को मिल रहा है. टारगेट सेल का स्ट्रक्चर मैंने अभी बताया था कि यू विल हैव लाइक या डार्क एरिया, बीच में पैलर होगा और फिर से डार्क एरिया होगा. सो दैट इज अ टारगेट सेल. सो टारगेट सेल्स आर लाइक ऑलमोस्ट लाइक वी हैव सीन इन previous images also, but what is more prominent where like in this particular image, it is the appearance of the sickle cell, which will actually give you the diagnosis that the patient is suffering from the sickle cell anemia, guys. The patient is suffering from the sickle cell anemia. That the patient is suffering from sickle cell anemia. Yes, yeah, I have just tried to cover the images, guys, which like everyone should know. So yeah, it was the sickle cell anemia where you will find the target cell plus the sickle cell. Sickle cells are again a feature of sickle cell anemia, typical feature. Nestrov test we have already discussed. It is for the thalassemia screening, where the lines will be present, the person is normal. Where the lines are not present, we can actually say thalassemia, but we need further diagnosis to confirm the patient is suffering from thalassemia or not. Apart from that, guys, I have already talked about you thalassemia minor में तीन चीज़ें देखने को मिल रही हैं. Basophilic stippling मिलेगी, nucleated RBC मिलेगी. Apart from that, you will get the pencil cell also. Pencil cell, basophilic stippling plus nucleated RBCs, again a feature of thalassemia minor. Thalassemia major में you can get multiple features. You have the target cells. Schistocytes will be like more new over here. Hypochromic RBCs, like it will be also more new. Nucleated RBC, Hobel Jolly bodies, I think multiple images, target cells you are also finding. But apart from that, what you have to remember, it is the schistocytes, hypochromic RBC, मतलब देखो पूरा का पूरा एरिया पेल दिख रहा है. It is the hypochromic RBCs, and along with that you will find the basophilic stippling. Along with that you will find the basophilic stippling, guys. Coarse basophilic stippling, basically it is for the lead poisoning. I have already told you. Here it is the fine basophilic stippling, basically it is scattered throughout cytoplasm. And apart from that, you will get a ring-like structure, that is the cabaret ring, and cabaret ring is again a feature of megaloblastic anemia. Yeah, I'm just revising. Hypersegmented neutrophils, macrovelocites, basically it is the megaloblastic anemia. Okay, we have already discussed. Yeah, megaloblastic done. Autoimmune hemolytic anemia, basically it is the agglutinin IgM. Yes, it is the agglutinin IgM. You can very well appreciate. Yeah, it is the agglutinin IgM. That is the cold agglutinin. Yeah, it is the cold agglutinin. So that are just clusters which you can very well appreciate. Crystal violet stain, basically the Haynes bodies, basically it is seen in G6PD deficiency anemia. Okay, G6PD deficiency anemia, you can very well appreciate. Yeah, G6PD deficiency anemia, byte cells will be like common, normal RBCs are there. Yeah, spirocytes I have already told you. Howell Jolly bodies, the structures, new methylene stains, Stilate Abscess, that is seen in the cat scratch disease. Yeah, one Casa Stain, that is for the calcium staining. Kala means black. Okay. So Pearl's Prussian blue for the iron granules, that is basically displayed. Oil grey dough stain lipids, fatty changes, Lipofuscin for perinuclear brown pigments. Okay, old aging वगैरह में जो देखने को मिलता है. Yeah, Cytomegalovirus, spleen, miliary tuberculosis of the spleen, multilobe nuclei. Yeah, chalky white deposits. Yes, smearing and or step ladder pattern, ये सब तो हो गया है. These structures like electron microscopy, myelin figures are more prominent in irreversible cell injury. That's already discussed. Alchian blue stains, like yeah, you can very well appreciate. Yeah, Barretts Esophagus and intestinal goblet cells. So yeah, that's all discussed. So I'll end the session. Yeah, thank you for your patience, your listening. So I'll come up with another session soon on systemic one also, and some images like are left for like hemat also. So I'll take another session as well. So just waiting. I hope you like the. I hope you understood all the images that I have discussed. So yeah, waiting for your response in the comment section so that it gives me like immense strength to come up with the next live session on another subject discussion. Same also, like up to you. Thank you everyone.